Let me tell you a story that can only happen in America. The other modern countries have gone way, way past this at this point. Megan Rothbauer is a 30-year-old Wisconsin woman, and she recently had a massive health problem. She had a heart attack. In fact, medical experts said that she technically died, and then she was in a coma for about 10 days, and she came back. So it really is an incredible story. But when she was taken to the hospital, apparently the hospital she went to wasn't in her health insurance network. Now, you guys are probably familiar with this. I'm familiar with this. I deal with this with my health insurance policy. So what ended up happening? She received a bill when she woke up from death for $254,000. She was stunned, needless to say, and she decided, this is not right, I'm going to fight this. So she negotiated, and she battled, and she argued, and she fought to try to get it reduced. And she succeeded to an extent, but not nearly enough. So $156,000 was taken off of the bill, but she still owes $98,000. So are you ready for the worst part of this? She may go bankrupt. Reports are out today that she may go bankrupt. She can't afford her wedding, which she was planning on having. And there was an in-network hospital just 3 blocks away. If she went there, you know how much she would have owed? $1,500. Because she's 3 blocks off. She owes $98,000. And remember, she clearly had no say in the matter. She was technically dead at the time they brought her to the wrong hospital. This is healthcare in the United States of America. Okay, don't get me wrong. Obamacare was definitely a step in the right direction. So, for example, 67,000 people had pre-existing conditions and they couldn't get health insurance. Now, those people do have coverage. 105 million people had what's called a lifetime cap. So if your insurance company spends over a certain amount of money on you, and people could hit that cap by the time they're 30, 40, 50, whatever, then they kick you off and you probably go bankrupt. Now nobody has a lifetime cap. And there are all these positive provisions, for sure. But the root problem is still there. The root cause of all the chaos and the misallocation of resources and the expensive nature of our healthcare system, it's still there. And that is that we have a for-profit healthcare and health insurance system. This doesn't happen in other modern nations. Go explain this to somebody from Canada. They will be mortified. They'll be like, I don't understand why you guys aren't fighting a revolution. Seriously. Go to Canada, go to Australia, go to Norway, Denmark, Iceland, Sweden, Finland, Greenland, France, Britain, anywhere. Go anywhere where it's a modern civilized nation. They'll be like, you guys are insane. You haven't fixed this yet? I mean, this system is a joke. It's an absolute pathetic joke. If people weren't getting killed, we fucking laugh at it nonstop, but people are dying as a result of this. We got to stop. We got to get away from this private health insurance, private health care model and system. There's nothing but cash-sucking, predatory, for-profit middlemen right in between you and your doctor. I mean, the health insurance companies, they have all these arbitrary rules, and even the idea of a fucking copay is ridiculous. Even if she had to pay the $1,500, I'd still think it's fucking ridiculous, because she's going to pay them $500 a month every month for years, and then when she gets in trouble and something actually happens, what do the insurance companies say? It's cool, we got it. You pay the first $1,500, and then maybe we'll cover it. Fuck you! Why the fuck have I been paying you this entire time? This is ridiculous. What a stupid business model. You rigged the system in your favor, and then you mandated by law that I have to partake in that system. It's insanity. Anybody can see the American people are getting fucked over in this system. Anybody can see this is unfair. You know how it should work? Very simple. Our tax dollars fund our health care, period. And you don't even need to raise taxes. You don't even need to raise taxes. You ready for this? I hope you're sitting down. 57% of our discretionary spending in the budget goes towards the military. So we're giving so much money to Raytheon, Halliburton, Boeing, KBR building tanks and anti-aircraft missiles and airplanes and small arms and all this stuff. I mean, we have 900 military bases around the country. We're still fighting in Iraq and Afghanistan and doing drone strikes in Pakistan, Yemen, and Somalia. 57%, more than half of our discretionary budget goes to war. Cut that in half, put the rest of it towards healthcare. Cut that in half, put half of that towards healthcare, and then we'll also cut back on the $80 billion subsidies that the big banks get every year. We'll cut back on the $4 billion welfare check that ExxonMobil gets every year. We'll cut back on the billions of dollars that Walmart gets. This is where we're going to cut back. We're going to cut back on that stuff. We don't even need to raise taxes, and we'll set up a Medicare for all system. And then nobody will ever have to pay a penny ever again when they get sick, when they get hurt. Here's how it works in other nations. You get sick, you get hurt, you get help. Then you leave. Then you go home and you continue with your life. In the U.S., you get sick, you get hurt. Sometimes even if you have insurance, you go fucking bankrupt. You want to talk about morality? You want to talk about the U.S. goes around the world and we preach to other nations how to act. We're going to bring freedom to your country. Really, that's what we're going to do. We're going to go help Middle Eastern countries when the fucking water was just shut off in Detroit. We can't keep the water on in a supposed first world nation, but we're going to go tell other people how to act. How about we take care of our shit first? How about we take care of that, and how about we actually give people health care?